Okay, so today we're going to talk about the Navajo group, and they're also considered part of the American Indians. So I'm Nicole.
I'm Leslie.
I'm Chelsea.
I'm Tiffany.
And I'm Jeff.
History of the Navajos archaeologically places them living north of New Mexico in between the 14th and 15th century, with the Pueblo people whom already existed there. The Navajo people lived in between four sacred mountains, which spans across Arizona, New Mexico, and Colorado, as you can see in the picture here. Each mountain is associated with a color. It is believed that these mountains were gifts from the holy people, so these mountains are extremely important to the Navajo people. The joining of these two people groups, the Navajo and Pueblo, proved to have a large impact on the Navajo culture. This is how the Navajo learned how to make and weave pottery. In the late 1800s, many were captured and forced to walk to New Mexico. This journey is referred to as the Long Walk. Upon their arrival, they were imprisoned and many of them died. 4 years later, a treaty was made between the U.S. and the Navajos. They were able to move back to the four sacred mountains and establish their first reservation. Today, the Navajo population is upwards of 360,000, which makes them the largest tribe in the U.S. Of this group, 32% have a high school diploma, and the average income is $27,000, with high rates of unemployment. The primary language spoken is Athapascan. This language is believed to reflect the universe, which is always in constant motion. An example of this would be like when someone like myself says, "I got dressed." A Navajo speaker would say, "I moved into my clothes." Most sentences contain the concept good. This promotes prosperity and happiness. Many words do not have a direct English translation, so it is important when using a translator to note things like that. The language was used as a code during World War II, which saved many lives. In regards to touch, mothers massage their newborn babies as a time for bonding. When a baby laughs for the first time, a small feast is made and gifts are given. The Navajo believe that it is taboo to touch a person or animal killed by lightning. At first, Navajos may appear silent and reserved. When stating their name, they honor their ancestors by stating the clan name and location of their home. Eye contact may be viewed as a sign of disrespect. Usually, the first encounter is not for dealing with official matters. It is for building relationships between the nurse and the family.
Okay, so in regards to space, space is compared to that of a small universe. Shared space provides a sense of security and trust, and they live in personal living spaces known as hogans that are surrounded by many traditions and superstitions. So the Navajo do not believe in imaginary space. They believe space is located in dimensions. For example, a living room can be compared to that of a small universe. The hogan, which you can see here in the picture, is a round open room with different functional areas. It is very important to the Navajos and often houses both the nuclear and extended families, but are spaced about a mile apart from the next hogan. Hogans are often isolated and far from public health resources. So because they believe space has no imaginary boundaries, it is important for the nurse to remember that some Navajos may have difficulty to adapting to environments like the hospital, which is very unfamiliar to them. The nurse needs to familiarize the client and explain that personal space may need to be invaded in order to perform certain assessments or procedures. Also, since the Navajo live in very close quarters, the nurse should assess for any infectious diseases that can be related to a lack of indoor plumbing, water supply, and even burns, which is commonly caused by the central oven here and stovetop. Since hogans are so isolated, there's a barrier with them between public transportation to health centers. So the nurse should inquire on the need for public health nurses to go into their community to assess and treat the people. So as far as time, they're primarily present time oriented. Many elders remain past and present oriented. Time is viewed on a continuum with no beginning and no end, and they believe man should live in harmony with the nature. So some Navajo homes don't even have clocks because time is casual and relative to the present needs that must be accomplished in the present time frame. So it is important for the nurses to understand that it's very hard for Navajos to keep their appointments, and it's a challenge for them to take their medications as prescribed. Nurses must do their best to educate the client on topics and importance of compliance. They should also include the patient in the planning and try to incorporate the plan of care around that. Nurses can help create reminders for the patient, but ultimately when the patient discharges, it's going to be up to them whether or not they are compliant or not. And social organization, they're very family oriented. They have a matriarchal society. The mother's role includes domestic roles within the home. The father works outside to sustain the family life, and children assist parents and are taught to respect tradition and honor wisdom. So since family is very important to them, the extended family is considered just as important as the nuclear family. They believe to be without relatives makes you poor, and children are taught from infancy that the family and tribe are of paramount importance. Being available for one another is very important in times of need. So as I stated earlier, they live in a matriarchal society, which means that when a couple marries, the husband makes his home with his wife's relatives, and his family becomes one of several units that live in a group of adjacent hogans. Children are viewed as assets, not liabilities, taught to live and learn by their own decisions. And since they believe that family members are responsible for each other, it's very common for multiple members to be present during a patient's hospital stay. So as nurses, it's important to bend the rules on maximum of 2 visitors at a time. Since their travel is very hard, they're coming from a very far place and they don't understand the limitations on only having 2 family members present. It's also great to include the family members by allowing them to wash or feed the patient because it helps them feel important in the plan of care. And discharge planning can also be done during this time with the family members in order to optimize the chance of compliance after discharge.
So environmental control, Navajo Indians are perceived as having an external locus of control. They believe that it is essential for man to live in harmony with nature and its elements. There is a strong relationship between self-esteem and positive attitudes towards health. Self-esteem is a modest predictor of behavior, attitudes, and health behavior intentions. Navajos believe it's essential to live in harmony with the environment and with the family. Health is not limited to the physical body, but encompasses congruence with family, environment, livestock, and supernatural forces, and the community as well. They utilize a lot of native healers, which is men and women who study the skills of medicine for many, many years. It's broken down into 3 categories, which would be diagnosticians, singers, and herbalists. First, diagnosticians diagnose what is the cause of the disharmony, and singers perform elaborate and complex healing ceremonies. One that they use is called blessing way. It's a Navajo practice that attempts to remove the illness by means of stories, songs, rituals, prayers, symbols, and sand paintings. And herbalists are specialized practitioners who use herbs to treat patients. Death and dying rituals are something that's very respected in their community. They respect death and the person the dead. When Navajos died, it is suggested by tradition that Navajos do not touch the body, or they don't even mention the person's name because it's a sign of contamination. You contaminate yourself and your environments by doing so. So they tend to avoid the discussion of death and dying as it is a reverent experience. Implications for nursing that we could use in our practice is determine which cultural health practices are beneficial, neutral, and harmful to the client to provide culturally appropriate care. It is essential for the nurse to respect the need of the Navajo people and to maintain traditional rituals even when hospitalized. So biological variations is that there is a high prevalence of obesity in American Indian children. They tend, like in this picture, they tend to be dark-skinned individuals, which is correlated with them always being outside, and it protects them from the effects of sunlight to a greater degree than light-skinned individuals are. There's a common cleft uvula, which is the separation of the tip of the earlobe, causing E shape. You'll see it in their ears. There's enzymatic variations, which include lactose intolerance, susceptibility to diseases like type 2 diabetes, tuberculosis, hypertension, Shigella, MIs, arthritis, HIV and AIDS, and colorectal cancer. So takes us to educate them on protection from these diseases and modifications that they can make that is acceptable to them and their culture.
Alrighty, so I'm going to talk to you all about the perception of health and illness. So, does the almighty spiritual force view the way Navajos see health and illness? Yes, it does. Most Navajos believe in the universe and that there is an almighty spiritual force that is the source of life. The winds and water courses and number of gods are worshipped since they are believed that they intervene with their daily human affairs. So the traditional Navajo religion is not separate from daily life, somewhat similar to Christianity. But the biggest difference is that they do not believe in heaven and hell as we do. So Navajos classify disease by an etiologic agent, and each healing ceremony is known by the causal factors that it is thought to cure. Disharmony is health. The health reflects living in total harmony with nature. Health, the earth is considered a living organism with the will and desire to be well. And illness, they believe that there's a reason for every sickness and pain experienced throughout their lifetime. Okay, so next I'm going to talk to you about some of the healing methods that the Navajos have. So as Leslie mentioned earlier, Navajos interpret all human suffering as disharmony. They basically say that the disease is simply a disharmony within oneself and within their body. So when Western medicine diagnoses them with a disease or something affecting even their organ systems, they say the underlying symptom is disharmony. So we have heat treatment, which they say is good for aches, swelling, and broken bones. And then basically they take the affected part, put it over a pit of hot coals, and cover it with blankets. So I know heat treatment is something we kind of do in Western medicine, just a little different. Next we have a sweat bath. That's a very popular home treatment as a way to repair damage to their spirit. So it's more about their inner selves when they go and do a sweat bath. Cornmeal. They take cornmeal and place it around the bedside for a curative, realistic ceremony, as you guys might have read in the case study at the end of the chapter with the grandma who placed it around her pregnant granddaughter's bedside at the hospital. And then corn is also the most important food that is eaten in multiple different ways within the Navajo culture. And then we have sand paintings, as is pictured down here. So sand paintings, that's a healing ceremony performed by the Navajo medicine men. Traditionally, they were made on the floor of teepees and the hogans. The sick person is placed in the middle, and the sandmen would perform the healing for them. So it was believed that the sand would absorb the sickness and that the patient would gain power to heal themselves. So in traditional Navajo teaching, if they were to consume a taboo food that would have an illness that would affect, they believed if they consumed a taboo food that would have a illness that would affect them later on in life. So some of the things that are strictly forbidden are reptiles, any type of seafood, okra, and blue agave syrup. There are also restrictions on how the food should be eaten, such as not stabbing the food with your knife, but only cutting it using a fork. So Navajo use plants that are that are tied to land, culture, and their different beliefs. So down here, I just listed a couple of them. You have the American English name and then the Navajo name and meaning for each of them. So I put the Navajo name in the parentheses. So you have the brown-eyed Susan, which is also known as the cutleaf cornflower. That one is good for heartburn, indigestion, and relief from cold and chest pain. You have the 4 o'clock, which is also known as the falling on rick. That's used for canker sores, swollen gum, or decayed teeth. And it's also used to treat bones in humans and animals. And then you have the sage brush, which is also known as the sagebrush. That's pictured, the 4 o'clock's pictured here. But the sagebrush is used to cure headaches by simply just having the odor. If you tea the stems and leaves, you can cure colds and fevers, and boiled is good for childbirth, indigestion, and constipation. So nursing implications of this, just as the nurse, you want to be respectful of the patient's culture, as in respecting their choice of healing methods. If it does not harm the patient in any way, then it is okay to be done by the patient and their family because that they believe in these healing methods.
So, once again, this is another picture of a traditional Navajo hogan. So it is very common for these people, once one person develops a disease such as tuberculosis, that it's spread throughout their community. So there's a very high incidence of that disease, as well as type 2 diabetes, hypertension, myocardial infarction, colorectal cancer, and rheumatoid arthritis. So as for interaction within the healthcare setting, it is important when speaking with a Navajo to use an interpreter if they do not speak English. They're a very quiet and trusting group of people, so it's possible for them to just trust the nurse with their best judgment. Once again, family is very important for them, so it's definitely something to keep in mind that they may be having many family members there at one time. They're present time oriented, so keep in mind that they may not be strict with their time, especially when it comes to medication. Being in harmony with the surroundings, a nurse must understand that they need to create harmony among not only the patient but the family in the room setting, and understanding practices such as, like Nicole said, with the cornmeal around the bed. That's something that's not necessarily harmful for the patient, so it is good to understand that that practice can still be done in the hospital setting. As far as a biblical worldview, we as Christians believe that God has created all things, including nature, and we find it important to seek and grow a relationship with God himself rather than his creation. So as for the Navajo people, their God is nature itself. A relationship with nature in harmony and peace is continuously sought after. Illness is believed to be caused by a disharmony between the individual and nature. So as nurses, we need to keep in mind Philippians 2:3-4. Do nothing from selfish ambition or conceit, but in humility count others more significant than yourselves. Let each of you look not only to his own interests, but also to the interests of others. It's very important that we see the interests of others and find that important, as well as treating not only the patient, but their whole family